Welcome back. The goal of a public participation survey making rounds in Winnebago County is to fill the gaps in services for mental health and substance use. Joining me today is Jason Holcomb with the Winnebago County Community Health Board. How are you?
Good.
Good. So I kind of just wanted to start with what type of info are you looking for with this survey?
Sure. So the Mental Health Board is really looking to understand the experiences of mental health services in Winnebago County from the perspective of people who are using the services, providers who are providing the services, and general community residents.
Yeah, and I know this survey is still out there, but what types of gaps do you already know exist in Winnebago County?
Well, the common knowledge gaps that we've kind of all known about for years are the lack of sufficient crisis response services and shortages of psychiatry, particularly with children's mental health. The things that we've learned because of public participation has been the challenges with transportation, getting to and from services, and workforce issues for those agencies that are trying to expand services and need people to fill positions.
Yeah, and you kind of touched on this already, but where would you say the Mental Health Board is the strongest in going after these gaps?
Well, when we talk about those gaps that really we've known about for years, the Mental Health Board has done a lot to fill those gaps and has funded 38 programs that do crisis response services, mental health treatment, client identification and outreach. That's 38 programs that didn't exist in our community 5 years ago that are really serving now more than 4,000 individuals every quarter, every 3 months, and 1,000 of those are youth that are receiving those services.
And I wanted to ask you too, just on the flip side, where would you say you guys are the weakest right now?
I would say care coordination. When you develop a lot of new programs, the challenge then becomes how does everything work together and fit together into a cohesive system of care. So that's one of the future-looking issues.
Yeah. So how important is it that people participate in this survey?
It's critically important. I talked about transportation and workforce. Those are things that we became aware of through past public participation. The Mental Health Board has now funded a rideshare program that helps people get transportation to services, and also a consortium of local colleges and universities to develop a career pathway for social work to help develop that local workforce for mental health as a result of public participation.
Yeah, so where can people find the survey and how long do they have until that deadline?
So we're keeping it open through, I believe, the first week of January, and there's going to be flyers all around town. Some of it will be in doctors' offices and mental health providers. If you see one of those flyers, get your phone out with the camera, go up to the QR code, and you'll get that direct link. Otherwise, you can find it on Region 1 Planning Council's public participation page, and it's called Engage R1, and that's at engageR1.mysocialpinpoint.com.
Perfect, and we'll make sure to have that later on WIFR.com so people can click on that. So thank you so much for being here today.
Thank you.